of the Dr. Joanne Lewis Foundation Heart Disease Awareness Walk. For the month of February, we have been walking with you 15 minutes every day, but we encourage you to walk 30 minutes every day for a total of 150 minutes a week. And we've been increasing your awareness of heart disease. And every day we've been sharing a little bit of information with you just to improve your understanding. So we encourage you to continue to walk with us for the month of February. Today is Sunday, February 15th. And so we're going to take a little bit of time out and talk about inflammation and heart disease. There's been a lot of talk about how inflammation contributes to heart disease. So what we have to first know is that inflammation is the body's natural defense response. So it's a natural thing. You can have acute inflammation, which is really short term, and in acute inflammation, it helps heal injuries or fight infections. There's the chronic inflammation, which is more long term, and this is harmful and can damage healthy tissues, including the heart. Chronic inflammation can persist for months or years, often driven by factors like high LDL cholesterol, high blood pressure, smoking, obesity, diabetes, or autoimmune diseases, which are all risk factors for heart disease. So as I'm talking, I'm walking, and I encourage you to walk along with me, okay? So inflammation contributes to heart disease, like I just said. It contributes to heart disease by accelerating atherosclerosis, which is plaque buildup. Cholesterol-rich plaque in arteries triggers an immune response. The body sends inflammatory cells to the plaque, which can enlarge the area or destabilize it. It increases the risk of plaque rupture. Inflammation can weaken the fibrous cap covering plaque. When this cap ruptures, a blood clot forms, the main cause of heart attacks and strokes. It strains and weakens the heart muscle. Chronic inflammation can stiffen or weaken the heart, contributing to heart failure, arrhythmias, reduced pumping ability. It interacts with other risk factors. So inflammation worsens the effect of high LDL, which we discussed yesterday, high blood pressure, high blood sugar, and smoking. So as providers, we measure inflammation with a common test that is called high sensitivity C-reactive protein. So if that level is less than 1 milligram per liter, you are at low risk. If it's 1 to 3 milligrams per liter, you are at average risk. But greater than 3 milligrams per liter, you have high cardiovascular risk. So all of this has been researched by the American Heart Association and Harvard, especially Harvard, and those experts at Harvard now argue that inflammation is as important as cholesterol in predicting heart disease risk. So how do we reduce inflammation and protect the heart? We have some common health strategies that I'm going to share with you, but as always, as I always tell you, please consult with your primary care provider or your cardiologist, because we do not give personal medical advice. But in general, I would say follow an anti-inflammatory, heart-healthy diet. So we have some information from Harvard Health and Northwestern Medicine, which highlights the Mediterranean diet that we discussed yesterday. We went through all the diets yesterday. The Mediterranean diet, the DASH diet, which emphasizes fruits, vegetables, whole grains, legumes, nuts, olive oil, and fish. What we encourage you to do is to avoid sugary drinks, red and processed meats, and refined carbs. We recommend that you exercise regularly for at least 150 minutes of moderate activity per week, which can help to lower inflammation and cardiovascular risk. If you smoke, please stop smoking. But don't smoke, period, because smoking is a risk factor for every single illness that you can think of. Smoking is a major trigger of arterial inflammation. Maintain a healthy weight and blood sugar. Obesity and diabetes are major drivers of chronic inflammation. Manage your stress. Manage your stress. Take some time for prayer and meditation, okay? Because chronic stress contributes to inflammatory pathways. So manage your stress. Get some medical therapy when appropriate. So there are statins to lower LDL, and it may also reduce inflammation. Again, as I always say, this is not personal medical advice. It's just in general, and I will encourage you to seek medical attention if you feel that you are at high risk. So for people with persistent inflammation, despite statins, low-dose colchicine is now an FDA approved to reduce cardiovascular risk. But prevention is the key, people. Prevention, diet, exercise, keep moving, okay? Don't smoke, limit your alcohol use, manage your stress. And with that, I bid you a happy Sabbath Sunday. Take care of yourselves, and I will see you soon. Pick up the pace a little bit, continue walking for at least 15 minutes.